Everybody. Good morning, everyone. Hi, this is Ali Mayetta in Congresswoman Bonamici's office. We are just getting everyone in from the waiting room. Thanks for being so punctual. And we will get started in just a few minutes, just a few seconds, really. Happy Friday and welcome to the Senior Resources Fair with Congresswoman Bonamici and our expert panelists. There are a few more people waiting to get in from the waiting room. And I think we've hit critical mass here. So Congresswoman, I will turn it over to you.
Great. Thanks so much, Ali. Thank you everyone so much for joining us today. It's really an honor to represent you, and I'm grateful we have a way to get together virtually. I want to thank my staff and the expert presenters for joining us, and thank all of you for your interest. It's really hard to overstate how much life has changed in the past year and a half, and I've spoken with Oregonians struggling with many issues: food, housing security, social isolation. The Delta variant is creating a surge in cases, and we know healthcare providers and hospitals are overwhelmed. The pandemic has exacerbated existing problems for many, including seniors. I've heard heartbreaking stories from seniors who have lost housing and support during the pandemic and faced, again, that social isolation that's been so hard. So Congress has passed into law several critical COVID relief packages that have been life-changing for families and individuals. And also, I've been leading the successful effort to address the growing needs of seniors by increasing funding for programs like Meals on Wheels, for care support for caregivers, senior advocates. This is through called the Older Americans Act. And I was able to secure an additional $18 million for Oregon seniors through that legislation. Not too long ago, I helped deliver Meals on Wheels to seniors in Beaverton. We were, of course, all masked and staying safe, but I always enjoy that, getting in touch with people, hearing their stories. One of the people we visited showed us her beautiful drawings of birds. I enjoyed visiting with her, as I know she enjoyed visiting with us. I also just helped the Education and Labor Committee advance our section of the Build Back Better Act. This historic legislation will offer more support for families in areas like childcare and pre-K, make higher education more affordable, create millions of jobs. And also, we're looking forward to making really a once-in-a-generation investments in several areas, including many that will affect seniors, adding dental, vision, and hearing coverage to Medicare. I know, as you do, that teeth and eyes and ears are part of the body. It's long past time for this important expansion that will benefit many people who struggle to afford a vision care, hearing aids, eyeglasses, or visits to the dentist. We're expanding home care for older and adults and people with disabilities while improving the jobs and the pay of the home care workers who care so much for them. I've spent time with a lot of caregivers during the last couple of years of my mom's life. She passed away last year, and I have such great respect for the hard and important work of our caregivers. And I just recently spent time with a home care worker in Beaverton. I have such deep appreciation for those caregivers who make sure everyone in our community can thrive. Separate from the pandemic response, I've also led an effort to protect older workers from age discrimination on the job, which unfortunately is far too common. I've been working on the Protecting Older Workers Against Discrimination Act, a common sense bipartisan bill that will restore the legal rights of older workers who experience age discrimination in application and employment. So I'm thrilled to help get it past the House in June, hoping we can get that through the Senate and across the finish line. And I remain committed to providing our communities with the policies and the resources they need to recover and thrive now and for generations to come. Now, before I turn it over to the expert panelists, I want to let you know that my office can help constituents who are having trouble with federal agencies. My staff is working remotely, but they're working hard, and I'll give you the phone number that you can call: 503-469-6010. And you can leave a message and we'll get back to you, or you can submit a response through my website, bonamici.house.gov. So I'm really excited and grateful to be joined by experts today from Social Security, Medicare, and the Oregon Attorney General's Office who will join me in answering your questions. We have three experts here today. Ken Gardner, the Director of Casework Management for Medicare. He's in Seattle. Alan Edwards, a Senior Public Affairs Specialist with the Social Security Administration. And Ellen Clem, the Director of Consumer Outreach and Education for the Office of our Oregon Attorney General. We're going to start with Ken. As I mentioned, Ken Gardner is the Director of the Division of Casework Management, Division of Health Plan Operations, Centers for Medicare and Medicaid Services in Seattle. They help people with Medicare or insurance through the health insurance marketplace when they have a problem enrolling or using their health or drug plans. I'm going to turn it over to Ken.
Thank you very much, Congresswoman, and good morning, everybody. Let me just share my screen here so you can see my slides. Hopefully that's working. So CMS administers three major programs: Medicare, Medicaid, and the health insurance marketplace. And I'm really going to talk mostly about Medicare today. But you can see our three programs here. And for local assistance with Medicare, I recommend you talk with Oregon SHIBA, or the Senior Health Insurance Benefits Assistance Program. Also with Medicaid, Oregon Health Plan, it's running, Medicaid can run in conjunction with the state. So OHP is the option there. And of course, the health insurance marketplace, Oregon has its own exchange, but uses the federal platform for enrollment at healthcare.gov. Medicare open enrollment is coming right up October 15th to December 7th. And every year as Medicare, as open enrollment approaches, seniors get inundated with mail, TV ads, and sometimes phone calls about changing their Medicare plan. And this year in particular, we've had a huge spike in complaints where people who say that they've been enrolled in health plans they didn't agree to join, or in a plan that doesn't have the benefits that they expected. And sadly, most of those complaints, or many of those complaints, mention the commercials that you've all seen, narrated by Joe Namath or Jimmy Walker. So I just wanted to point this out. I get a million questions about these. You know, these are screenshots from the ads, and notice that, you know, Joe Namath here is saying they instantly looked up my coverage. And you call this, they're both from the same company, Medicare Coverage Helpline, which is not associated with the government. They demand your Medicare number and all your personal information, or they say they can't help you. Don't give them your number. I really recommend you don't do that. In the lower screenshot with Jimmy Walker, talks about how they told him he was entitled to an extra $100 a month in his Social Security check. Well, very few people qualify for that, and only if they're very low income. And I don't think Mr. Walker qualifies based on at least the internet searches showing his net wealth. So one of the problems that we have is sometimes people will call saying that they're from Medicare, and you shouldn't necessarily trust that unless you have called Medicare first. Nobody from Medicare will call you unless you've called our 1-800-MEDICARE call center, or you've sent us a letter or a note, or emailed us, or written the president or the secretary, something like that. If that happens, then oftentimes a case will be referred to my office, and then someone from my staff will call you. And one of the problems we have is people don't want to talk to us because they've already been scammed once usually, and they're afraid it's another problem. So I will just say, if you've called 1-800-MEDICARE and someone calls you saying they're from the Medicare regional office, please take that call or return that message. They're not going to ask you for your Medicare number. We've already got that. They may ask you a question or two just to make sure it's you, but we're not going to ask you for a bunch of sensitive information. Now, I said before that I'd tell you who qualifies for those extra benefits that those, Joe Namath commercials talk about. If you have Medicare and Medicaid, or Medicare and Oregon Health Plan, then OHP may pay your Medicare premium. Also, if your income is low, you may or may not have Oregon Health Plan. There's something we call Extra Help. It's a program that helps you pay for your prescription drugs. It dramatically lowers the cost of your prescriptions. Also, if you have certain chronic conditions, you might be eligible for special benefits like transportation to appointments, home delivered meals, enhanced dental benefits and such. But that's only if you qualify for both Medicare and Medicaid and belong to a Medicare Advantage plan. And lastly, I'll just say that if your income is below $19,320 for an individual, $26,130 for a married couple, and your resources are less, that is your savings are less than $14,790, then you may qualify for extra help, and you can find out by calling Social Security. Now, if your income is higher, then if your income is above $88,000 a year as a single person or $176,000 as a married couple, you will pay more for your Medicare premiums. It's something called IRMA. We get a lot of complaints about that. All I can say is if you're assessed that, it's based on your income from 2 years before. And we can help you if you get in trouble with that, but pay those bills when they come in, because if they're late, it can cause a lot of heartache for you. And a couple of last key points. We get a lot of complaints about late enrollment penalties. If you're eligible for Medicare and don't have any other coverage, you should sign up for something. Otherwise, it'll cost you more when you eventually do join. If you're first joining Medicare, maybe you're leaving your employer coverage, there's something called a Medigap guaranteed issue period that's extremely important. If you have a chronic condition or really, maybe you've got cancer or something like that that's really expensive, it's a period of 6 months during which you can buy a Medigap plan without any health questions. And the best advice of all is get your advice from someone that you trust. I recommend Oregon Sheba. There's their phone number, or talk to a local reputable agent who knows all your local options, not one of these big national call centers. And I will turn it back to Ollie.
Thank you so much, Ken. That was really helpful information. Now I'm going to turn it over to Alan Edwards, who is the Senior Public Affairs Specialist for the Denver and Seattle regions of the Social Security Administration. Thanks, Alan, for joining us.
Thank you, Congresswoman, for the invitation. Thanks, everybody, for joining us out there in Cyberland today. I work in the Portland office, but we cover a large region. The interesting thing about Social Security as compared to Medicare is that Social Security has over 1,300 offices throughout the country. And so when it comes time to enroll in Medicare, it's generally at Social Security that you're either coming or you're filing online or you're giving us a call. So I have a couple of things I'd like to echo about and expand on what Ken said, because we are seeing a lot of the same types of things Medicare is seeing. And one of the number one things we're seeing is fraudulent activity. I don't know how many times I've gotten a call, and it's not a Nigerian prince wanting to give me money. It is somebody now that wants to threaten me or suspend my Social Security number or throw me in prison unless I pay some kind of a fee or send them some kind of a transmission. That's not going to happen. We don't call people out of the blue. We will contact you by phone if you have reached out to us and request a phone appointment, if you have business with us, but you're the one who initiates that. So the number one thing I can say really with that is don't be fooled. Just hang up. That's probably the best advice to give. My mom just turned 80. She's gotten a couple of calls this last month, and she does the same thing. I just hung up, Alan. I said, excellent. That's exactly what you do. If you have internet access and you'd like to help us out a little bit more, we have a website, socialsecurity.gov, and just make sure it's the .gov. That's the important part. And there is a link on that page to report any types of these calls. And it really does help, because information that we gather, we share with regulatory agencies. This gets shared with Congress. And this is really good information to go after these scammers and these fraud callers. So watch out for that. It is a huge deal right now. And we're getting a lot of increases in calls about folks getting these unsolicited telephone calls or messages. Secondly, I'd like to talk a little bit about Medicare itself. I mentioned Social Security has a lot of offices in the country, and A lot of people look at Social Security as the place to file for, their retirement, their disability benefits, survivor benefits, but it also is the place where you would contact to start up that Medicare. One very important thing to keep in mind is that the Medicare decision is not necessarily tied directly to Social Security. You're eligible for Medicare first, either based on disability after 2 years being on the disability program, or when you turn 65. And there is a window of opportunity to get into that Medicare and get that started. If you enroll later, there are exceptions, but there can also be higher charges if you get in later than age 65. So it's important, really important, to, I would say, contact us a few months before you turn 65, explain your situation. Are you currently receiving Social Security? Are you still working? Is your spouse still working? Do you have other insurance? Those are the types of things that we want to go over with you so that you aren't in a situation where you have a surcharge or a higher amount that you have to pay later for the Medicare. It is not necessarily tied to Social Security. So many people may hold off to get their Social Security benefits till after 65. The full retirement age is going up little by little. You can still retire as early as 62 and get early benefits at a reduced amount, but Medicare generally kicks in at 65. So you can file these applications for Social Security and or Medicare at our website, socialsecurity.gov. An excellent link right on our homepage to the different enrollment periods for Medicare, as well as for your options in signing up for benefits. We also have an 800 number. It's also on the webpage, but I'll give it to you now. It's 800-772-1213. 772-1213. And in addition to that, during the current pandemic, what we are doing is we're offering a lot of service directly through our local offices. So you can reach us at the Contact Us link at the bottom of our socialsecurity.gov page. Type in a zip code and we can get you the actual number of your local servicing office, because obviously we want to keep people safe and we want to make sure that we're providing all your information timely. Finally, I just wanted to mention that the annual trustees report has just come out. And so if you haven't heard about this is an annual report that Social Security makes to Congress, talks about the funding and the current state of the Social Security payments future. And we just had our chief actuary who presented a Facebook presentation. This is actually, there's a link to it right from our homepage at socialsecurity.gov. And you can take a look at some of the major findings of that report. And I just want to wrap it up really by thanking everybody for the opportunity to participate, and want to encourage everyone to check out that website or give us a call so that you're in the know. Thanks very much.
Thanks so much, Alan, for that very helpful information. I have a consumer protection background. So when you're mentioning the deluge of ads and those phone calls, which I've received myself, it's really good to know that to just hang up, but then to report the call too. That's really helpful. And last but not least, I'm going to turn it over to Ellen Clem. Ellen is the Director of Consumer Outreach and Education for the Office of the Oregon Attorney General. Her mission is to prevent financial harm to Oregonians, especially older adults. So I'm going to turn it over to Ellen. Thanks for joining us.
Thank you so much, Congresswoman. I am so excited to be here and see some familiar faces. This is a wonderful event, and I'm honored to be invited to present. I did want to follow up on what Alan was talking about and what the Congressman mentioned, this notion of just hanging up the phone. As the Director of Outreach and Education for the Oregon Attorney General, pre-COVID, I spent most of my time traveling all around the state and talking to mostly older adults about how to stay safe from frauds and scams. And one of the things I learned fairly quickly is a lot of people, myself included, we were taught to answer every single phone call to be polite to the person on the other end. And the world has changed since then. And I went back after one particular presentation and chatted with the Attorney General, and I said, we need a flyer or a sticker or a magnet or something that people can put right next to their phones so that when they get those phone calls out of the blue, they know that it's okay to just hang up. And I wasn't planning on sharing this earlier, but I'm going to share this now. This is our Just Hang Up campaign. This is a flyer that we put together a few years ago, like I said, in response to some of these imposter scams. And I encourage you to visit our website. You can download this, you can call our office and we can mail it to you for free. And it's a great, I'm not sure why it's not, there it goes. It has some great tips on here about, they ask you to wire money or buy a prepaid card, or they say that you've won something. So lots of great tips, a really helpful piece of information that you can, like I said, put it on your refrigerator, put it next to your phone. We also have another one that is a little more specific to surfing the web, and this is our Do Not Click campaign. So lots of great resources available from the Oregon Department of Justice, mostly aimed at older adults and how we can keep them safe and keep that money that you've earned in your pockets. So with that being said, I'm now going to share the slide that I said I was going to share, which is a little bit more about me and how the Oregon Department of Justice can be a resource for you. As I mentioned, pre-pandemic, I spent most of my time traveling the state, presenting to, again, mostly older adults, individuals that care and interact with older adults. I am giving my first in-person presentation on Monday in Lake Oswego, and I'm so excited to, quote, be back. I couldn't be happier about that. I'm still giving virtual presentations, and I'm quickly booking up for those in-person presentations where I cover in a lot more detail how you can, avoid becoming a victim, what to do if you have been a victim. So here's my contact information right here on this slide. This is my that's my cell phone number. So if you call me, please don't call me maybe during this presentation, but if you call me, I will answer. And I am hopeful that we can find a time to connect and I can help you stay safe. And I also wanted to highlight, as you see on this slide, I talked about some of those materials like our Just Hang Up, Do Not
Ellen,
Click.
I'm just seeing the Do Not Click screen. So if
Oh,
you
still?
Ellen
Oh,
could work
shoot.
on making sure that you're getting the number up. So it's,
Oh, gosh.
it hasn't switched to the Do Not. There we go.
Thank you. I was telling Allie before this presentation that sometimes the DOJ firewalls are a little odd, and I had warned her beforehand, and here we are. So thank you for letting me know. So yes, now you should be able to see the correct phone number for me. As I mentioned, this is my cell phone. There's my email address right there. You can call, email, text, and request a presentation, request help with maybe a particular issue that you're dealing with. You can also visit our website, oregonconsumer.gov, to download those materials that I showed you earlier. I do want to highlight one last thing before I turn it back to the Congresswoman, which is our Elder Abuse Conference. For 4 years now, entering its 5th year, we have held a conference aimed at training law enforcement, prosecutors, and investigators on how to prevent, address, and prosecute crimes related to abuse of older adults. For the first time ever, we are actually opening up a portion of that conference to the general public, and it's free. So if you'd like to attend, the conference will take place, the public portion will take place on Wednesday, October 27th, in the afternoon. I believe the start time is around 11:30. We're still finalizing some details there, but you can sign up on our website, oregonattorneygeneral.gov. And as I mentioned, it's free to attend. It's a virtual event, and it should be a lot of fun and informative. And I guess I will close the portion of my presentation there. So thank you again for having me, and I'm excited to hear your questions.
Thank you so much, Ellen. If you wouldn't mind just reading off that phone number, that would be great.
Sure. So my
font
cell
is a little
phone,
small.
sure. My cell phone number is 503-507-1061.
Thank you so much. Now, we're going to turn to the questions and answers. And I just want to give you a reminder, this is a public forum. We have close to 100 people on the line. So please do not share any personally identifying information in your comment or question, like your birthday, your address, social security number. Of course, it's okay to share your first name and a phone number if you'd like our office to follow up with you. But just be careful about sharing personal information. So now, Allie's going to help moderate. And if you have a question, you can use that raise hand function. If you go to reactions at the bottom and click on it, there's a raise hand function there. You can see I just raise my hand, and then you can go back and lower your hand, or you can wave like this and we'll get you in line to ask a question. So Allie, I'll turn it over
That's
to you.
great. I have a list of about 5 people who have weighed in with questions, starting with Yaroslav, who got the first raise hand in. So Yaroslav, you can unmute yourself and ask your question.
You're still muted. Yaroslav, we can't hear you. So if you click, there we go. Thank you.
Hello, Susan.
Nice
Our
to meet you.
international community, glad to see you.
Nice to see you as well.
We work with you long time and happy see you today. You help so much our international community. We have now, I will shortly say, try it with my bad English, but my friend will be speak better English for you, Olga. We have now problem with DHS. DHS now go for new system, new electronic system. Its electronic system now work very bad. They promise they will consultation with us. No consultation. Our people no good work with computer. Now we have classes for all these people for computer, but very complicated system and in DHS and very bad working. Please look for that system in DHS and help international community work with this system. Thank you for time for me. I glad see Susan.
Yeah, very nice to see you as well. And I know sometimes this transition to doing things electronically and virtually can really be challenging. And there are equity issues too. Not everybody has a computer and access to a computer. So thank you so much for bringing that to our attention. Maybe my staff can get your contact information and we can follow up to see if there's anything we can do specifically to help the community. But thank you.
Yes,
Nice to see you.
We invite you coming in Saturday for our welcome to Beaverton event, and your staff say me, you're so busy, I cannot come into our event. I am sorry.
Maybe soon. But yeah, well, I have a pretty busy schedule, but nice to see you. Thank you for joining us today.
And our next question is from Steve Thompson about the VA. Steve, you're free to unmute yourself and ask your question.
Thank you. Hello, Congresswoman Bonamici. It's been some time since we've seen each other.
Nice to see you, Steve.
I am wondering about programs for seniors that are living with a relative and the relative is having to care for them, either through the VA or Social Security or some other program. I know there are some income caps, but I'm wondering if there's something either specifically for Oregon or for outside of the state that would be available for a relative that has a senior living with them and they're caring for them.
Thank you for that question, Steve. And I know the value of caregiving is huge. And if somebody has to give up another source of income to care for a family member, that's hugely problematic because the care is important, but so is the income. This is part of what we're working on now with the Build Back Better legislation and making sure that caregivers are compensated and making sure that people get the care they need. So I would say stay tuned in the next couple of weeks as this legislation moves forward. Caregiving is something that we're looking at as a really important investment. And in fact, I just met with a home caregiver recently, and they had to give up their job and to stay home and take care of their adult child with disabilities. And so what happens in those situations? So we want to make sure that caregivers can be compensated and make sure that their important work is recognized for the value that there is. And so, Steve, if we could get your contact information, we can follow up with you on whether there are any. I know that if there are existing programs are not nearly sufficient, which is why we're working on this as part of our Build Back Better legislation. So thanks for the question and good to see you.
Thank you, you too.
Great. And our next question is from Becky Rose, who has a hand raised. Then we'll go to Linda, and then I see Howard Shapiro. So we'll get you in there next. But first, let's do Becky Rose with a hand raised.
Okay, Suzanne.
Hello.
Hi. I go way back. I'm just going to remind you really quickly that I was, and I still am, across from Nellie Fox Edwards' house in Beaverton.
Oh my goodness.
Yeah. So
may she rest in peace. What a wonderful woman.
yes. And anyway, you and I used to do the whole library thing. Anyway, moving right along, I am just also going to pile on the caregiver bandwagon. I know you get it. I just want to tell a little story. My mom recently needed 24/7 care. And fortunately, we had the resources to pay for some. And it is the best thing that ever happened to our family. I mean, I was just amazed at how much having someone who actually cares about you and all the aspects of your health, you know what I mean? Are you clean? Are you dressed? Are you eating well? Are you having fun? It made her blossom like nothing else ever has. And of course, if we went to Medicare or whatever, we would get $0 for that kind of care. So I'm just, again, piling on with the story that that's where resources need to be directed, not towards, you know, more drugs, more hospitals, more surgeries, more, yeah. That's
Becky,
it.
thank you so much. I very much appreciate that. And again, there is a tremendous equity gap. I was fortunate enough to be able to find excellent care for my mom, but we had to pay a lot for it, and not everybody can do that. And so I appreciate that you shared your stories. Stories really do matter. I'm going to ask our expert panelists if anybody has any ideas about, you know, from your perspective about, you know, this challenge that we've heard in a couple of questions about caregivers and particularly at-home care, in-home care workers. I don't know if our expert panelists have anything they can add. Ken, Alan, or Ellen?
I'll just say it's not an area that I know terribly well. It's in the Medicaid arena, but each state Medicare program does have opportunities to help provide support to what they call IHSS, in-home services and support. But those rules vary from state to state, so I don't know the rules in each state. Also, going to the previous question, or the VA system has something similar. So you can contact the Veterans Administration, but I'm sure that the Congresswoman's office can help connect you to the right people to get answers on that.
Thank you. Our next
Great.
question, Allie?
Yes, we've got a few more people who want. Let's go to Linda with Social Security, and then I have Mira, Howard, and Marissa. I see you, Marissa.
Hi, Congresswoman.
Linda.
This is a wonderful opportunity to just have an outreach with the community, and we just really appreciate it.
Thank you. I appreciate your joining us.
So my question has to do with how Social Security is going to be safeguarded. And wondering what Congress is going to do to help safeguard that in light of what we're hearing in the news about increased taxes. And yeah, just wondering if you have any update on that.
Well, I have always looked at Social Security and Medicare as earned benefits that are so important, essential programs that provide financial security, that allow, I mean, they were created so that Americans could age with dignity. And so I don't think that the economic challenges that we're going through now are any excuse to dismantle or privatize or compromise those. So there are many ways that we can keep the Social Security Trust Fund solvent. And certainly the amount of money that's taxed to pay into Social Security, there are proposals to raise the cap or eliminate the cap that will help. Cost of living, the COLA adjustments to me are essential, because as costs go up, so should benefits. So there are different proposals for that. I support tying it to a particular consumer price index for the elderly, which is more accurately reflecting expenses of older adults. And you mentioned something about tax increases. The tax increases that are being discussed right now are not going to affect working families. They're really for high income earners and corporations, large corporations. So they're not going to affect working people or people who are retired for the most part, unless they have a huge income. So that I want to reassure you that that right now the tax proposals are really a progressive, not progressive and liberal, but as opposed to regressive. They're going to help low income families and working people, and just will be high income earners and large corporations paying their fair share. So that I want to reassure you about that. So and you have my commitment that I will do everything I can to help protect and preserve Social Security. And I don't know if Alan would like to weigh in on this as well.
Sure, thank you very much. I mentioned just before during my opening remarks that every year the Social Security Board of Trustees comes out with an annual report, and that report's really revealing, especially over this last year when you look at, oh, hey, we've considered what's gone on with the economy, the impact of the pandemic, what's happening, going into the future. It's important, I think, really to remember that what really is driving the need for some sort of legislative adjustment to the program is just demographics. There are more people in the country now, percentage-wise, that are over the age of 65, so filing benefits. The birth rates have really dropped down over the past 30 years. So there's a lot less people coming in for everyone that's going out and drawing the benefit that they've earned. And thirdly, the important really is just longevity. People are living longer. That means a longer period of time that they're drawing benefits. And so there's a number of ways, some of which are addressed in this presentation that you can watch, linked to our website. And it's right off of our homepage, talks a little bit about changes, talks a little bit about what's happening currently. Also, really interesting, on our webpage, you can go to socialsecurity.gov and to the search bar, little search bar, and type in the word proposals. It will bring up what currently is happening right now in Congress, what different legislative and elected officials have proposed. Anything from changing the way benefits are paid, taxation of benefits, limits on what earnings are taxed. There's many different provisions that are discussed, and you can actually track individual proposals as they go in real time. And so I think we've got some really good resources out there for folks to kind of look to see where we are now, and then also to see what's being addressed specifically to deal with the future of funding for the program for everybody.
Great. All right. Thank you both.
Thank you, Linda. That's really helpful, Alan. And for those of you who check on those proposals, even if I'm already sponsoring bills to strengthen Social Security, it's still great to hear from you if you support that. So please don't hesitate to reach out to my office and weigh in on the pending pieces of legislation. Who's next, Allie?
First, we have a quick question from Mira about how to report scams that I thought Ellen might be able to answer. And then let's go to Howard Shapiro. We'll get to you, Howard, and then Marissa.
Great. That is a wonderful question. I apologize I didn't address that in my earlier remarks. Absolutely report if you have been a victim of a fraud or a scam to our office. It's very easy to do. You can just visit our website, oregonconsumer.gov. You can also call the Attorney General's Consumer Hotline, and I'll give you that number. It's 1-877-877-9392. That number again is 1-877-877-9392. And of course, as always, you can just call me directly. So that's the best way to report scams, is to the Oregon Department of Justice, and we'll take it from there.
Thank you, Ellen.
So much.
That's really helpful. Who's next,
All
Allie?
right, and let's go to Howard and then Marissa, and then I have a few more people in the queue.
Hello, Howard. Is Howard with us?
Howard, you're muted.
We can hear you, Howard, but I'm trying to unmute you here. Do you see a little pop-up on your screen? Can't hear you yet, but I just asked you to, there we go.
Hello, Howard.
Good morning, everyone. My name is Howard Shapiro, as it says on there. For the last 30 years, I've been running a men's-only caregiving support group for men caregivers that have been caring for their spouses. I cared for my late wife for about 20 years. She had a stroke. I started this group because I didn't know how to put on a brassiere for a young lady. I didn't know how to dress and undress a young lady, pardon the expressions, but it was tough being a man in a caregiving environment. And so I decided to call for help. Well, the help wasn't there, and I started the help 30 years ago. It is still going right now on Zoom. We used to meet at Good Sam for over 20 years, and then we start meeting on Zoom because of the pandemic. But I understand what caregiving is. I understand the mechanics of it. It's a bunch of guys caring for their wives. You guys are caring for us in your positions, Social Security, Medicare, and all the good stuff. But the important stuff is caring for the guy that is caring for their spouse. And I cannot stress it enough, because we meet once a month and a bunch of guys visit and share their aches and pains. And a lot of guys cry, and that's the best place for tears. The screen is just loaded with tears, but they get to speak to people that are going through the same challenges as being a care in a society that is not important enough to have a caregiving responsibility job. And that's your job, Congressman Bonamici. Your job is to care for your constituents in another way other than in a way that it's going to cost money. This doesn't cost any money. This doesn't cost it. It just costs time. And the time for an hour and a half that these guys can talk about their aches and pains and share their heartaches. And they learn from each other, from one fella to another fella. So this is why my hand was raised. It was answering all the other challenges that all you folks were talking about, and it stems for a guy caring for their spouse. I'm off the soapbox. Continue.
Howard, thank you so much for sharing that. And thank you for 30 years worth of bringing people together, the men caregivers. And, you know, in general, caregiving has not been valued and recognized it's a very, very important role. and you emphasize that. So I applaud you. Somebody saying, can Howard share his contact information, please? Because I think there are others who are interested in your wonderful group. So what a remarkable thing you've done. And I can only imagine what that means to the other male caregivers. What very, very wonderful of you to share that. And if you could share your contact.
Every single month, it's mailed out to all these guys. I remind them of the meeting. I give them a little PMA, positive mental attitude, so that they can look forward to help. They can't find it at the grocery store or the doctor's office.
Right.
The only place they can get to it is on the Zoom or in person.
Well, I want you to know
the address.
I want you to know that I think certainly now, during and after the pandemic, there is an increased awareness of the value of caregivers and how important they are. I personally spent so much time with my mother's caregivers, and you can't thank them enough for the work that they were doing. And I know from helping to care for my mom, who passed away at 92 and two-time cancer survivor with Alzheimer's. It takes a lot of work and patience, and oftentimes that care is being done by people who are family members. And so thank you again, Howard, for your support group. And you're getting a lot of positive feedback in the chat there. So thank you again for joining us and for all you're doing.
Thank you.
Our next question goes to Marissa. Marissa, I know you had to join from
Yes.
another device, but if we can get you on here, we'd love to hear your
I am.
question.
Absolutely.
Hello, Marissa.
Hello, Suzanne. And I don't know if you know if the connection is there. I am the oldest of the Mazzaras. And
I see a family resemblance.
we missed you at my mom's gathering last week.
I know. I'm apologizing.
It was a fantastic. We threw a pandemic surprise 79th birthday party for my mother last week to come out of COVID. So, and we've been very good friends with the Congresswoman for years. And
I sent you greetings, and I hope it was a lovely
celebration. She did. She got them and she appreciated it. And I've also worked with Ellen years ago. So my background is that I own a home care agency in the Portland area. And Ellen, I was the one who our phones got attacked by robocallers, by scammers years ago. Yes. And we ended up on the news and everything over it. And as I was listening, Allie saw me. I was like going nuts as I was driving. There were so many things I could answer there. For those of you in Oregon, if finances are an issue, contact your DHS office, your APD office, adult and people with disabilities, and see if you qualify for Medicaid. And you can get caregiving hours through Medicaid. Sometimes it's limited, but it is there. Congresswoman, one thing that I could send to you, or if I could impart to you, I know that there's been a work on having Medicare covering home care hours as time goes on. Insurance does not cover it, and our elders have Medicare. And the reality is it is cheaper and better to care for somebody at home than it is in a facility or in a hospital. And we can do almost everything at home that needs to be done to take care of a person, regardless if it's after surgery or all the way through end of life, but there's not enough dollars funneled. And as a private agency, it's challenging for us, especially right now. It's very challenging. So we are limited. Yaroslav, is talking about the EVV, electronic verification, that's required now of anybody that gets the Medicaid dollars, and that's a tough one. We spent a year training our staff on how to do it, and we're 100%. But for people in the community, they don't have access to a lot of that stuff. So it is definitely challenging. What I will say is that there are a lot of resources out there for people that are that are at home trying to figure out what to do. I'll put in the chat box. There's a great opportunity or a great resource that you guys can look up information. It's called the Retirement Connection. And they have tons and tons of information It's grown in, it was a grassroots thing, and it's grown into this massive coordinated effort throughout Oregon and Washington. And it's lots of providers, and it's not just home care providers, it's assisted livings, and it's facilities and everything. But reach out to those folks in your area. Reach out to different agencies and just ask questions, about things. That we're out here and have a lot of resources. So the two big things for me right now, Congresswoman, would be more Medicare dollars for home care versus and caregiving. The supplement is not worth it. Right now, it covers maybe 5 hours a month, and it's an expensive supplement. So it was like yeah, Medicare's doing this, but it's not doing anything. And then the funding for the DHS hours, for Medicaid hours, so that we can actually get a decent reimbursement and really provide care for people that need it.
Marissa, thank you. That's so helpful. I really, really appreciate your perspective. And I think one of the things you emphasized is, here in Oregon, we're sort of a leader in some of these options for people, and making sure that if someone does want to remain in their home, that they can get that care. Or if someone wants to be in assisted living, I see in the chat somebody
absolutely
so lonely, I prefer assisted living, to have those options available.
We have some great options.
So important. Adult foster homes. I mean, there's just a whole range of options for people.
There are,
but they're also, as I mentioned, equity concerns about who can access them, and that's
absolutely
where your comment is well received from my perspective. Is that sometimes the dollars go to more expensive services, but not to the less expensive, preferred, more effective services. So
exactly. And for people who really do want to stay home, they're stuck. They're really stuck, and a lot of people are forced into moving into settings that they don't want to move into, and giving up a home that they've been in their whole lifetime. And
right.
So
thank you, Marissa.
I could go on. I'm not going to. Have a great day.
Choices, but
I'll put my information in the chat box too. If
Thank you very
much. I can.
Who's next, Ally?
Okay. Unfortunately, I think we only have time for a couple more questions. There's been some great discussion about alternative medicine in the chat. Thank you, Ken, for weighing in. And we've talked quite a bit about home care. I'd love to go to Hector with a question about expanding Medicare to cover dental, vision, and hearing, and then Claire Fallon about loneliness. So Hector, you're free to unmute yourself.
Hi, Congresswoman. Thank you for doing this. Appreciate it.
Of course.
We're out in Hillsborough, Washington County, your old stomping background.
Yeah, nice to see you.
Yes, and so for us seniors, the older we get, my hearing's going, my vision is going. We need help, and dental, of course. And then the other one is just group life insurance. I keep running into seniors that I work with that still don't carry life insurance and can't afford it. And so those are my 4 areas of expansion that I'd like to advocate for.
Thank you, Hector. And right now, as we speak, we are working on what's called Build Back Better, which is a package of laws from proposals from various committees in the House in this big bill that we're working on. We're hoping to get through the House and the Senate within the next few weeks. In fact, that's our goal. And one of the proposals that is in a portion of this bill is to expand Medicare to cover vision, dental, and hearing, because we know if those are not covered and people defer care in those areas, they could end up spending more later. It's worse for their health, and it's worse for the pocketbook. So we're working on that. That is part of the proposal. Just have to get it through both the House and the Senate. But I certainly support it. And you're right. I mean, as I mentioned, the teeth and the ears and the eyes are all part of the body and should be covered. So and I'm not sure about the group life insurance. We can certainly look into that, but I know with the expansion of Medicare, it's at the top of the list right now for the Congress as we're working on that very important expansion. So thank you.
Thank you.
Do any of our other experts want to weigh in maybe on the group life insurance?
I think is relevant to a lot of participants is about a Social Security cost of living increase. And I'll let you take that first, Congresswoman, and then from there we'll wrap it up.
Yeah, I certainly have, as I mentioned, supported the cost of living increases, and the consumer price index for the elderly is how I'd like to tie future COLAs or cost of living increases, because it's an index that more accurately measures the expenses of older adults. So that's what I support. And I don't know if Alan wants to weigh in on this as well.
Yeah, sure. Just real quick. The cost of living calculation is actually set in statute. So it's actually determined based on looking at an index, and that's the Consumer Price Index -W. So CPI -W, which is for workers and generally workers, urban and clerical. It generally tracks the cost of living or expenses from the third quarter of one year to the third quarter of the next year. We will be having an announcement here within the next few weeks. Generally, it's mid-October that we come out with a big press announcement, and it'll be on all the stations and all the papers, I'm sure. They are expecting cost of living increase. The amount a little bit up in the air. We do have some really good background on that COLA information too on our website, but we will definitely be coming out with that very shortly.
Thank you so much, Alan. That's helpful. Allie, do we have time for another question?
Unfortunately, I think we're almost out of time.
Goodness. Well, I know there are a lot of questions that if for some reason we did not get to your question, please do not hesitate to reach out to my office. I know there are many, many excellent topics raised here today. I want to thank each and every one of you for joining us, and really to our expert presenters. Thank you so much. I appreciate your experience and your insight. Thank you, Ken Gardner, Alan Edwards, and Ellen Clem. So everyone who RSVP'd for this webinar is going to be receiving a follow-up email. And that email will include information and the resources that we shared today. So don't worry if you didn't write everything down or get every link. We're going to send that to you via email. And again, my office is available to help constituents who are having trouble with the federal agency. Even though my staff is mostly working remotely, they're working hard. And here's that number again, and we'll put this in the follow-up email as well, 503-469-6010, and leave a message and we'll get back to you. Or you can submit a request through my website, bonamici.house.gov. I just want to say thank you again to everyone for joining us. I also want to mention, if you have not been fully vaccinated, please talk with your healthcare provider. It's so critical right now at this time during the pandemic with the Delta variant. So please talk with your healthcare provider and take very good care and stay safe out there. Thanks again to my staff and our experts, and mostly thanks to all of you who joined us today.
Very good.
Thank you. Take care and have a great weekend.
Very good, young lady. Let's do it again.
Thank you, Howard. Thanks, everybody.
Thank you.